What every woman should know about estrogen. A seminar for women.
Good morning, everybody. My name is Dr. Marilyn Hughes. We're here to talk about menopause. My goal this morning is to help you understand the things our bodies go through during menopause, to recognize the symptoms of menopause, and to understand its management and treatment. I'd like to keep this informal, so if you have any questions at all as we go along, feel free to ask them. Now, many women refer to menopause as the change of life, and that's not a bad description. Our bodies indeed do go through a change. During childbearing years, our ovaries produce estrogen. Estrogen is a hormone, sort of a chemical messenger that helps control a number of female functions. When we were teenagers, for example, it started our periods. It caused our breasts to develop. And throughout our adult years, it regulated our periods and the production of eggs in our ovaries. Now, as we approach menopause, our ovaries produce less and less estrogen, and our periods become irregular. After menopause, our ovaries stop producing estrogen altogether, and our periods stop. Once that happens, we may be faced with a number of problems. Yes?
Doctor, for the past few months, I've been waking up at night covered in sweat. I understand that's a symptom of menopause, but I wonder if you discuss some of the other problems we can expect down the road.
Of course. And I wish I could give you a definitive list of the symptoms you may encounter, but we're all different, so I think it's best if I concentrate on the major symptoms. You're right about the night sweats. That is a prime symptom of menopause. The reason for them is that estrogen helps control our body's heat regulators. As the regulators try to adjust to the loss of estrogen, we get periods of heavy sweating and occasional sudden hot flashes, both during the day and at night. Estrogen loss also causes the lining of the vagina to become thinner, making intercourse painful and irritating. It's also not uncommon to feel some loss in our sense of well-being and vitality, and along with those feelings, some irritability and lack of energy, much of which is attributed to our sleep being interrupted by night sweats. It's a fact of life. A great number of physical changes come with menopause. With menopause, there are also longer-term consequences to consider. We've already mentioned hot flashes and sweating, but that's not all. Bones, skin, and hair all change, and our cardiovascular health may be affected. Bones become brittle, skin becomes drier, easily bruised, hair becomes thinner. During menopause, we may also experience urinary problems, such as increased frequency and urgency of urination. An increase in urinary tract infections is not uncommon. Yes?
Two things. First, what sort of time frame are we talking about? I mean, how long do these symptoms hang on? And second, can we expect to experience all of the symptoms?
Let me take your second question first. Most women have at least some of the symptoms. Only a few get away with having none at all. Keep in mind that all of our bodies are different. The symptoms and severity will vary from woman to woman. Time frame? Well, it's hard to say exactly. The uncomfortable hot flashes may last for 2 or 3 years. For most women, they eventually go away. There are, however, other problems related to estrogen loss that you can't feel. And these problems don't go away. They can stay with you for years, and they can be very serious. This is a good time to talk about them. One problem is a condition called osteoporosis, a weakening of bone, causing it to become brittle. Over the course of the aging process, bone loss is common to everybody. At menopause, however, that loss is greatly accelerated. Look at this example. The right side of this model shows a healthy, dense, strong bone. The other side is weak and porous because it's lost calcium. Without estrogen, our body can't absorb all the calcium it needs to help keep our bones strong. The result is that our bones may become thin and weak. The result can be a broken hip. This is why some women may become stooped and bent over in their later years. What happens is the bones in the spine can no longer support the weight, and they begin to collapse. That, in turn, causes the spine to curve into a painful condition known as dowager's hump. About 1 in 4 women will develop osteoporosis in later years. Certain women are more at risk than others. For example, if you're white with a fair complexion and a slender build, you're generally at greater risk than women with dark complexions and heavier builds. Let me stop here for a moment. I don't want you to get discouraged. Please keep in mind as we move along this morning that there is effective treatment available to relieve the short-term symptoms and to prevent many of the long-term problems associated with menopause. We'll talk about that in just a bit.
Dr. Hughes, I like to think I live a relatively healthy life. I exercise, watch my diet, take calcium supplements, don't smoke, all the things we've been told to do. Will that help avoid some of the problems associated with menopause?
I'm glad you take good care of yourself. That's a big plus. But once estrogen is lost, calcium, exercise, and healthy living may not be enough to protect you. Without estrogen, your body may not be able to use the calcium you give it. You know, it's ironic that we have menopause as a problem at all. After all, you can make the case that menopause is a result of medical progress. Think about it. At the turn of the century, a woman was expected to live to about 50, right about the onset of menopause. Now we can expect to live to about 80, which means we live some 30 years without the estrogen we need to protect ourselves. But there is relief, an effective treatment called estrogen replacement therapy, or ERT. ERT simply replaces the estrogen your body loses after menopause. In most women, it is very effective in relieving the short-term symptoms of estrogen deficiency almost immediately. If taking estrogen is right for you, there is an estrogen product your doctor can confidently prescribe to replace the natural estrogen your ovaries once produced. Most women who take estrogen replacement take a drug called Premarin. In fact, Premarin is prescribed by doctors for nearly 5 million women each year. It's got a wonderful record of experience. Almost 50 years. If you have symptoms, you should begin to feel better after just a short time. Premarin has been proven time and again to relieve hot flashes, night sweats, and vaginal dryness and irritation associated with estrogen loss in most women. And by relieving those distressing symptoms, your vitality may be restored to its old level because your sleep patterns return to normal. But Premarin goes beyond just relieving the uncomfortable symptoms of menopause. There are long-term benefits, too. For example, taking Premarin will protect your bones and your vaginal tissues. So, when you begin Premarin, follow your doctor's instructions to get the long-term benefits it has to offer.
Dr. Hughes,
Yes?
when you say it's important to continue to take Premarin, how long a time are you talking about?
Anywhere from 5 to 10 years in order to get protection from long-term problems.
Dr. Hughes, I'm already having very painful intercourse. Will taking Premarin give me quick relief?
In most cases, ERT relieves the vaginal dryness and irritation that causes intercourse to be painful. This is a condition called atrophic vaginitis, and it responds well to estrogen replacement therapy.
You mentioned osteoporosis a little earlier. Will estrogen therapy help prevent the problem of osteoporosis?
Yes. Studies have shown that a combination of calcium and estrogen tablets is effective in preventing postmenopausal bone loss. In fact, estrogen therapy has been shown to be the single most important factor in preventing this disease. You had a question?
Yes, doctor. Some of my friends tell me that there's a risk of cancer if you take estrogen. That scares me.
The thought of getting cancer is always scary. I'm glad you brought it up. Most of the concern has been focused on endometrial cancer and breast cancer. Modern approaches to estrogen replacement have minimized those risks. Let's look at breast cancer first. Some studies have suggested a possible increased incidence of breast cancer in women taking higher doses of estrogen over a prolonged period of time, generally more than 10 years. The majority of studies, however, have shown that the use of estrogen has not increased the risk of breast cancer in women taking the usual doses used in estrogen replacement therapy. Whether they take estrogen or not, 1 in 9 women will develop breast cancer. That's why I recommend annual mammograms and regular self-examination for all of my patients. whether or not they're on estrogen. On the other hand, endometrial cancer rarely occurs in women over 50. Something like 1 woman in 1,000 will get it. Let me explain. The lining of the uterus is called the endometrium. In early regimens of ERT, using estrogen alone, there was an increased risk of endometrial overgrowth, which can sometimes lead to cancer. The approach most physicians use today is to prescribe estrogen along with progestin to reduce the risk of endometrial overgrowth. Progestin is another female hormone, one that enables the uterus to shed its built-up endometrial tissue on a regular basis. This shedding occurs once every month, usually 2 or 3 days of light spotting or bleeding. Typically, you won't have the cramping, bloating, or PMS discomfort you may have experienced with your period. This light monthly discharge indicates you are being protected against endometrial overgrowth. Also, keep in mind, if you have had a hysterectomy, your uterus has been removed and thus you are not at risk for this type of cancer. Now, I must point out that taking estrogen isn't right for everyone. I can't be more specific here with so many individual cases, but please understand that there are medical reasons why some women shouldn't take it. As an example, a woman who has a previous history of breast cancer is not an appropriate candidate for ERT. For most women, however, the benefits of ERT far outweigh the risks. Yes,
So, how many pills would I be taking?
it depends. Doctors may prescribe a number of different regimens. A common one, the one I prescribe, is easy to follow. From the first day of the month to the 25th, you take Premarin. On the 16th day, you add the progestin pill to your regimen, and on the 25th day, you stop both pills. You take no medication from the 26th day until the end of the month. During that time, you'll probably experience some light spotting or bleeding I mentioned earlier. Again, this light monthly bleeding means your therapy is working and your endometrium is being protected against overgrowth. And you don't have to be concerned about getting pregnant. My approach to estrogen therapy is to use large doses of common sense along with the ERT regimen. See your doctor for regular pelvic examinations. Self-examine your breasts regularly and get an annual mammogram. Call your doctor immediately should you experience any unusual bleeding or side effects. In many cases, a simple dose adjustment is all that is needed. Let me close by telling you that I've been on estrogen therapy for 5 years. It was an easy decision for me to make. Look, we can't stop the aging process, but we sure can make the most of every stage of our lives. And that begins with taking care of our health. I look at estrogen as long-term health protection.
When your doctor prescribes Premarin, this is what Premarin looks like in its various dosage strengths. There are no other Premarin tablets available.